Insurance has launched their 20 years anniversary with the theme Health Heroes 20 Years Strong. The event was led by the National Health Insurance Chief Executive Officer, Dr.Oko Boye, in his engagement with the media said that the cabinet has asked National Insurance Scheme to work with the Ministry of Health to provide the needed support access. He urged the Ghanaians to contribute to the scheme in order not to burden anyone, he said.
It's been 20 years of achievements, 20 years of complaints, 20 years of challenges, 20 years of requests for promotion, 20 years of all kinds of nice things. What is important is that we are determined to keep on moving with a lot of arrogance. Because if you are humble, you should see those who know more than you and try to be close. And that is what we want to be, an organization that is always looking up to those who we think are ahead of us and getting inspired to perfection. At 20 years, I'd like to acknowledge the immense efforts of past leaders of this organization, from board chairman to board members to members of parliament, politicians, influencers, the clergy, all those who have stood firm to make sure that health insurance grows immensely.
This nation. Together we shall safeguard hope, healing, and health for every individual, ensuring that this invaluable wealth of well-being remains accessible to all. Colleagues, distinguished guests, ladies and gentlemen, this 2-year anniversary of NHIS promises to be exciting as it will be enthralling. Collectively, we have drawn an all-inclusive and elaborate 1-year-long event to mark this amazing feat. The MCs who are former staff, can they also join us? Of the Son and the Holy Ghost. Hooray!
And also how to discuss other ways of funding. Because when you pay more, the assumption should be that those who are paying should necessarily pay more. But there are many ways of bringing in some influence into the fund. And those are the ways that we have to discuss. I think that what we are saying is not traditionally to just go and say 2.5% VAT NHI levy, go to 3.5%. That's not what they're saying. But there are innovative ways to improve on the inflows that comes from the National Insurance Scheme. Dr. Oko Boye is not having all the other approaches. It must be dialogue. We must sit in a room where some suggestions will come from the media. Doc, have you considered this particular avenue? Is it possible to get something from that place? Have you considered the way you are collecting funds? Is it possible to change the vehicle you are using? We should engage in discussions that will improve. The most important thing is that we have to improve on our collections. How to improve, one person has not got the answer. And by the way, the answers are available. We only have to sit and talk.
National insurance the scheme covers about 95% of the disease conditions that are in Ghana. The remaining 5% that are not covered includes kidney disease, chronic kidney disease, heart conditions, liver cancer, and other kinds of cancers. Following the uproar and the difficulties that the kidney patients had been experiencing, Cabinet has more or less asked the National Insurance Scheme to work with the Ministry of Health to see how we can provide support and access. We have to remember that 20 years ago, when the National Insurance was birthed It is not for bad reasons that they left out chronic kidney disease. Every insurance scheme tries to be careful how much it carries on its neck so that its neck does not break. But it does not also mean that forever we cannot shoulder those burdens. And so let's thank God that today the discussions have started. I made mention that in the past 25 years or so, anyone who's had kidney disease, they've had to pay from their pocket. We are today discussing it because there is this coalition and advocacy. We should not stop at only kidney disease. We should also look at mental health care. We should look at other cancers. The men are saying that prostate should also be brought on board. Currently, it's only breast cancer for the women, and I think cervical that are covered by health insurance. But there is one thing I have to mention. Anytime you continue to add benefits to any health insurance package, what you must start looking at is the inflow side, how much money you receive. In this country, we have paid the same processing fee for health insurance for the past 14 years. Nobody has talked about how to sit down and start a discussion on paying realistic, processing fees. Ghanaians who are not on SNIT, their premium that they pay for health insurance has remained at about 27 cedis for 13 years. 27 Ghana cedis 30 years ago is valued 5-6 times what you pay today. So, in as much as we don't want to burden any Ghanaian with taxes, we must also look at how we can support the scheme so that whenever they ask us to add on any package, we gladly accept and add on the package. I'm happy that we are looking at dialysis for now. Let me quickly say that the president has charged us to consider and add mental health diseases like depression, schizophrenia, all are going to be added to the scheme. And what we don't want to have is a scheme that has every disease on it, but when it comes to paying, has challenges. Currently, the support of the Ministry of Finance has been very good. That is why you don't hear hospitals shouting that they are not being paid. Now, the payment is very good. What they are asking for is an increase in the tariffs or the prices that we pay. All these things will be discussed. Like I said, let's keep on talking. Let's keep on dialoguing. We want improvement. We want improvement when it comes to charges at the hospital. We want that practice to go down. We want improvement when it comes to the benefits package. But we also want improvement when it comes to money that flows into the scheme. If we tolerate all these discussions, I am sure in the next 5-10 years, we will continue to rise in Africa as one of the best schemes in the world. The theme is celebrating our heroes. We should continue to thank God for the life of President Kufuor. President Kufuor and succeeding governments have shown us that no matter our challenges as a country, if we come together, we should be able to solve some of our key problems. As we speak now, there are women who are receiving cesarean section in Tamale because they have health insurance. As we speak now, there are men who are having emergency surgery for irreducible hernia because they have insurance card. As we speak now, there is a child with fever who is able to access health care only because the national health insurance exists. And so many more can receive care. The kidney patient who is struggling now, tomorrow can receive care if we continue to work hard at health insurance. Tomorrow it will be possible to have heart surgeries through health insurance. Everything is possible. We only have to believe and work hard.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.